Heated high-flow nasal cannula is used on BBI for escalating respiratory needs or when weaning from higher support to lower support. It is heated and humidified oxygen that washes out the upper airway dead space and reduces work of breathing while improving mucus clearance. There are two different kinds of setups for high flow. The most common is the vapotherm, shown here. There is a flow meter, FiO2 blender, and the heater, all in the same system. This then connects to the tubing, which then goes to the patient's nasal cannula. Make sure to select the appropriate size nasal cannula for your patient. There is strict inclusion and exclusion criteria for having high flow on the BBI unit. First, the patient must be between 2 months and 24 months old with a diagnosis of bronchiolitis or viral pneumonia. The max flow is 2 liters per kilogram or up to 20 liters with a max FiO2 of 40%. Exclusion criteria, or reasons that prevent a patient from staying on the BBI unit, is being preterm, less than 34 weeks, history of bronchopulmonary dysplasia, chronic lung disease, congenital heart disease, pulmonary hypertension, home oxygen needs at baseline, history of intubation related to respiratory diagnosis, or baseline neuromuscular weakness. Also, patients with continuous albuterol needs, a pneumothorax, or any signs of respiratory failure, such as decreased level of consciousness, apnea, bradycardia, or poor perfusion. Do not hesitate to ask the question, does this patient need a higher level of care? Use your cuss words. I am concerned, I am uncomfortable, or this is a safety issue. Initiation of high flow on the BBI unit starts with a rapid response. The entire team then will make decisions moving forward. The first step is to stabilize the patient as needed. Make them NPO, place the patient on cardiorespiratory monitoring, a continuous pulse ox, and after initiation, complete vital signs every 30 minutes. Coordinate with your RT and doctors for titration. The liter flow aligns with the work of breathing, and the FiO2 is adjusted for oxygen saturation levels. So if your patient is having a higher work of breathing, their liter flow needs to be increased, whereas if your patient is desaturating, their FiO2 needs to be increased. This patient still requires the basic supportive care needed, including suctioning, hydration, and rest. Don't forget to think about skin breakdown and use a barrier between the cannula and the patient's skin. Complete frequent reassessment of any patient on high flow. And don't forget to organize a specific follow-up plan after the initial rapid response and high flow initiation. Call a pediatric rapid response if your patient's BPU score is greater than or equal to 6, or greater than or equal to 8 if they are already on high flow. If the patient is requiring over 40% FiO2, needing a flow greater than 2 liters per kilogram, or if the patient is ill appearing and worsening, such as increased work of breathing, vital sign changes, or signs of respiratory failure. If you have any questions, partner with your provider, respiratory therapist, and charge nurse to give this patient the highest quality care possible.